network rather. And I forgot to mention, we'll be recording this webinar so that we can make it available to a wider audience. So please just take note. Thank you.
Yeah. Thank you very much, Felix, and good morning or good afternoon to everyone, depending on where we are. My name is Gloria Maimela. Felix, if that's okay, I'm going to just share my slides quickly on the Chance Network.
Please go ahead.
Please let me know if you can see the slides. Can you all see the slides?
Yes.
Yes, we can.
Yes, we can.
Okay. So mine is a short one, everyone. I'm just here to just give you a bit of an overview of the Chance Network. So the Chance Network stands for Climate and Health Africa Network for Collaboration and Engagement. We were established in 2021 as a platform. So the vision of the Chance Network is to alleviate the burden, obviously, like everyone else, alleviate the burden of climate change and health on health systems in Africa. And we want to provide an enabling environment to engage with a diversity of stakeholders such as yourself to address health and climate priorities in Africa. And so the main aim of the Chance Network is to advance networking, and hence we have these sessions to advance research, learning, and policy and financing for climate change and health in the African region. And you'll see that we have a lovely logo that we've recently established. So in terms of our objectives, we want to enhance networks and synergies for climate change and health in Africa, facilitate knowledge exchange, facilitate research collaboration, as I mentioned before, support and inform evidence-based policy development, facilitate technical support to access climate financing for climate and health research and other related activities. So these are, in terms of our activities, we have various focus areas, that include looking at extreme weather events, health system strengthening, and today's webinar focuses a lot on that. Heat stress, climate-sensitive infectious diseases, as well as air pollution, including wildfires. And how we engage with our key stakeholders is through bi-monthly webinars. We'll also be having workshops. We have annual conferences, and I'll tell you about the conference that's coming up in October. And we also now recently established an online information hub where our members can access information around the various top focus areas that we cover. We are growing, and we have over 200 members who form official Chance Network members, and we're spread across the African region with varying interests among our members. But the bulk of our members are in Eastern and Southern Africa. But we're now growing membership, particularly in the West Africa, and we have other members who are part of the steering committee who are outside of Africa who are providing technical support. So in terms of what's next, what's new, there's a lot of activities that are coming up. As I mentioned, we've got the bi-monthly webinars. We are part of the GCCHE Africa Climate and Health Responder course. Some of our steering committee members are part of that, and we've got there's information about that. Various courses that have been scheduled, and so please, if there's a link there for you to register. You can just go on the website and click Africa Climate and Health Responder courses if you're interested in some of the climate and health courses that they're aimed at building capacity on climate change and health. And we are happy that as Chance Network, we've partnered with GCSHE to support this capacity building. We also will be part of the first Climate and Health Africa Conference in October that's taking place in Harare, Zimbabwe. So also please be on the lookout for that and register to attend if you can. The Chance Network will be hosting our own conference within that conference on day 3. where we'll have policymakers coming in, meeting with researchers, and we'll be presenting the latest evidence on climate change and best practices from across the African region. And obviously, as I said, we've got webinars. Recently, we had a webinar on, impact beyond the impact factor with Jason Glaser, but these are regular webinars that we hold frequently. So, yeah, so that we've also been looking at documenting and publishing case studies, success stories, and lessons learned in the region. And also we have an element of focusing on fundraising for the Chance Network. This is a QR scan if you'd like to register to become a member so that you can get access to all these this information there it is, and you can also get hold of us. Caroline Motoni is on the group as well. You can reach out and we can assist you in getting registered as a Chance member. Thank you very much. Over to you, Felix.
Thank you so much, Gloria. I also provided some information about the Climate Resilient and Sustainable Health Systems, TWG, in the chat, so people can also see get more information about that TWG. Now we are right at the main meat of this webinar. So I want to invite Rudolf, who will be making a presentation on building climate resilient and sustainable health systems in Africa and lessons from PAC actors in Ghana. Over to you, Rudolf.
Thank you, Felix, and then Gloria. So I'm waiting for my screen. Okay. Can you put on presentation mode? Hello? Can we get on presentation mode? Okay, so today basically we're talking about building climate resilient health systems in Africa. Basically, you all know that Africa, our challenges are similar, and then we believe that using lessons from Ghana would also provide the springboard for other African countries and even beyond Africa to learn from it or probably improve on it. So I think that we'll be doing this in the next 1 hour or so. Next slide. Celestine, are you with me? Hello? Can you hear me?
Rudolf, I think you can continue.
No, I'm not controlling the slides. Celestine is doing that. Yeah, so next slide. Hello?
Yeah, so maybe Rudolf, alternatively, maybe you can quickly share your own slides in case Celestine is having challenges with network, please.
Yeah, Caroline, do you have the slides? Or sorry?
I don't.
Yeah.
I can do it. Yeah, hang on.
Okay. So maybe.
Apologies, colleagues, as we sort out.
Yeah, there's a technical glitch, yeah.
Yeah, but I think, Rudolf, maybe you can provide some background to this about the TWG while you're working, while we are sorting it.
So our TWG is basically focusing on climate resilience and sustainable health systems, as you know already. Felix would have told you that. And again, what we aim to do is to also coordinate policy, as well as also prevent best actionable steps, that is from evidence-based strategies, and then to strengthen climate resilient health systems. We have facilitators, so that means that you have contact points across Africa and the globe. And then Renzo is our chair. We have a number of vice chairs for the different regions. And then basically you can join us also on, join our working group. And then again, I want to also take the opportunity to let you know that during the 8th Global Symposium, we will be having two sessions. One, it's an organized session, and one is a capacity building session. And then we're looking forward to those who will be there in person to join this. Next slide. Yes, so basically, obviously we're going to have an introduction, and then we're going to dive deep into the nexus between climate change and health systems. Many people do not get a connection about this, so we'll try to see if we can do that. We'll look at some of the frameworks that are available to guide us do this, and we'll focus on the WHO. Then we'll zoom into barriers and facilitators for mainstreaming. We'll get the opportunity to interact, and then we'll move to the second session, which is about opportunities and levers, and discussion and closing. So looking forward to a very interactive session in the next 1 hour. Next slide. Yes, so why must we adapt to why must the health systems adapt and mitigate? Shockingly, 100 million people are at risk of extreme poverty by 2030, according to the World Bank. And then again, it is to be primarily due to the losses that we make in the health sector. So the health of people alone is going to contribute to getting 100 million people at risk of extreme poverty, or if not exactly extreme poverty. And then again, extreme weather events. I think we have seen it across Africa, in South Africa, in Ghana last year, and we continue to see them cause losses to infrastructure worth 253 billion in 2021. And you obviously know that once there's infrastructure loss, the health systems suffers heavy losses. So it's important to look at it. Then importantly, climate change undermines universal health coverage, because once we are struggling to get healthcare to everybody, climate change, the effects of climate change destroy some of these things or adds additional burden to what we are already doing or our health facilities, and that leads to much more problems. Ironically, the health sector, which is struggling to get everybody well in the globe, accounts for 5% of global health greenhouse gases emissions. So that is why we have to mitigate at our own level based on what we can do. And then interestingly, despite the overall knowledge that climate change is the biggest threat to humanity in the 21st century, only 50% of countries in the world have got climate change and health plans. And once you don't have a plan, we know you cannot respond. And then even with these 50%, there is very low to moderate implementation of it. And then finally, we know that PHCs or primary healthcare are critical to universal health coverage and health systems adaptation. Over 50% in some countries, over 50% of services are rendered, health services are rendered by PHC. And then again, so if we have to adapt, then it means that PHC is critical to this. Next slide. Yeah, so now we go to the first part of the our interaction. I think we're going to use Mentimeter, and then you can find it with the code on the chat box. And then we have about 3 minutes. We would like participants to identify climate hazards specific to their locality that negatively impact on health systems. So please, the code is in the chat box, and the link is also in the chat box. So we're looking forward to see your thoughts on this. Are we good to go, Celestine?
Yes, we're good to go. Shari,
Okay.
can I share the results?
Yes. Are you able to log in? You can find the link in the chat box, and that is the code you see on your screen. It can be done by mobile phone. Just log in and then just identify any climate hazards that are specific to your locality that negatively impact health systems. We begin to get 8 responses. We have about 86 participants. I can see air pollution. I can see drought, heat wave, heat, water shortage, floods, and flooding. We had 15 responses. I encourage you to log in. I think in the next 1 minute or so, we will be closing the poll. You find the Mentimeter link in the chat box, and there's the code also there. Yes, 22 responses. We are getting there. Yeah. Okay. So I think that I can see flooding, heat waves or heat, droughts, and then well, water shortage. That's correct. Probably leading to resulting from droughts. So I think that with the responses we are getting so far, it is very clear that we are all affected by these climate hazards, and obviously they are also impacting negatively on our health systems. So I think that, Celestine, can we go back to the slide now? I think we've used our 3 minutes now. Can you share the screen? Yeah. Okay. Next slide. Yes. Thank you very much. Now, most questions I get when I started doing my work, people couldn't connect the link. Well, people could connect the link between climate change and health, but they absolutely could not connect the link between climate change and health systems. Now I have 2 pictures. On my right, you see a very beautiful health facility. We call it CHIPS. It's a community-based health facility. And then again, it is 800 kilometers from the capital. It's typically rural. And I think that you would literally clap hands for the government of Ghana for doing this. But if you look down the screen, you would notice that there are waterways there. It's prone, the ground is prone to flood. So what happens is that absolutely nobody can attend this health facility when it rains. So effectively, the decision to site it has kind of affected the optimum use of the health facility. Now, to my left, you would also find that, or to your right, you would also find out that there's another beautiful health facility. But if you look at the edge of it, it is quite modern. It has renewable standbys, solar, everything. But you would find out that there's a growth by it. That is a waterway. So what it means is that the day we have flooding, then there's going to be a problem. So these are the things we talk about when we talk about the climate resilient health facilities. And admittedly, you would know that we can ultimately change this because we are going to do the investment anyway without having to have additional costs. It's just about somebody being proactive to decide to site it in the right place. Next slide. Yes, and I further give you examples. You would see on my left, you'd see obviously there's a ward there. Somebody's lying in the ward. It was the time of Corona. Very beautiful health facility, modern facility. I think the fellow came in because the fellow was sick. And obviously you see a flood there. So now you can imagine what will happen to the fellow, how the fellow feels mentally, how the health workers even get there, and how would healthcare be delivered. Now, the second picture from my left is obviously a delivery room in a rural health facility. You can see that there are leakages. That is just because a storm had kind of ripped off the roof, and then it wasn't seen as a priority, and now you have a delivery room that is leaking when it rains. So you can imagine what happens there. Now you can find myself, I went to a health facility in the community when I was doing this work, and then again, before I returned, there was rain, and then obviously the road was cut off. So you can imagine what happens to a pregnant woman who is supposed to be referred to the nearest facility. Then you can find the story there from Ghana Web also. A medical doctor that takes so many years to train actually lost her life after going to the hospital. That is in the city of Accra. After going to the hospital, it rained, she was going home, there's a flood, she got an accident and she died. 7 years of waste. So these are examples of some of the nexus or the impact of climate hazards on health systems. Next slide. Yes, and then again, you would notice that on my left, you will find a health center somewhere in Madagascar. I got this from the WHO Afro website. And then you see that it's totally ripped off during a storm or so. I didn't see people mention storms, but yeah, I think there was storm there. Again, then now you ask yourself, if people get injured in this storm, and then they are supposed to visit this health facility, what happens to it? So again, that is another example. And then on my right, you can see that a whole electricity pole, it's bent down, and there are communities ahead with health facilities that is meant to serve. What happens to the vaccines that are there? And what happens to the critical services that need electricity to function in these health facilities? So again, decisions as to how we can prevent bushfire or decisions as to how we can work around to make sure that these are safe also lie around climate resilience. Next slide. Next slide. Yes. So now we come to the main topic of the day. Facilitators and barriers to mainstreaming climate change adaptation mitigation into subnational health systems. Obviously, we want to do the perspectives from Ghana. I think that we all know climate change exists, but let's look at it from our angle. What has prevented us from implementing it? Next slide. Yes, so we do have a number of global frameworks on climate change and health systems, how they would adapt. But I think that the WHO is the most favored one in Africa. And then on my left, obviously, what all these tell us is that we need a health system to be able to build on climate resilience. So on my left, we have the building blocks for health systems that was published by the WHO in 2023. And then again, initially in 2015, this is much more updated in 2023. So all what it says is that we need to add 10 components to the 6 building blocks that we already know of health services to be able to build climate resilient health systems. For example, we have climate smart health workforce. That is something that it means that our health workforce must be able to understand the nexus between climate change and health, and then they should be able to implement this with the systems backing them. So it means that leadership itself might think mainstream of climate change to be able to get this. Then on my right, you would obviously find a much more specific framework for healthcare facilities. The WHO says that, okay, there are a number of hazards that affect health systems or health facilities directly. These are floods, drought, wildfires, storms, temperature, extreme temperatures, sea level rise, climate-sensitive disease outbreaks. And then again, we say that to be able to kind of make health systems resilient, then what we need to do is to focus on interventions around the health workforce, water, sanitation and hygiene and healthcare waste, the energy component, and infrastructure, technology, and products. So if we are able to make these climate smart, then we are in a position to make our health facilities climate resilient and also low carbon, or they become environmentally sustainable. Can we move on to the next slide? Yes. So now I think that we will we'll zoom into Ghana and what it is. Now you look at all these beautiful policies. I can count over 10. These are just the ones I have now. All of them identify the health sector or health systems as a priority area. So what then happens? At the national level, they are very beautiful policies that think that, okay, we must do health systems resilience. And then again, we would believe that once we have it at the national policy, this is supposed to be implemented at the primary health level. So we move on to the next slide to see whether this is the case. Next slide. Yeah, so you would obviously know that over the years, the last decade, despite favorable policy environment, progress in Ghana has been very slow. So we have the good policies, but progress is slow. So what we set out to do in this paper to examine context-specific facility and barriers to mainstream the WHO frameworks for climate change in PHC operations. And then why do we focus on PHCs? Well, in Ghana, PHC render over half of essential public health services and are the forefront of natural disasters. When there are natural disasters, they have to respond to meet the healthcare needs of those who are affected. And then we also believe that identifying context-specific factors and then enables policymakers to tailor mainstreaming strategies. So you know that for adaptation, it's always local. So once you understand properly, then you're able to get the right interventions. And then again, tailored strategies informed by local knowledge and community engagement promote sustainability, and that is bottom-up approaches. Next slide. Yes, so you would see, you see the Ghana map on top. You see where it's marked red, that's the Upper East region. And then you see the map of Upper East region there. And we deliberately chose Upper East region because it's one of the areas in the Sahel. So it has one of the harsh environmental conditions with a lot of climate hazards and climate sensitive disease outbreaks that occur from time to time. So we did multi-stage sampling, and then we settled on 3 districts or PHC programs that are marked in green in the map. And as you can see, the onogram on PHC, it's on the top right corner, the lower right corner, and that is the structure of PHC. And then again, PHCs in Ghana are standardized. They operate the same way, comprising of 3-level hospitals, district hospital, health centers, CHIP zones. And then again, they have a network of community structures and community health facilities that are talking to the people every day. Can we move to the next slide? Yes, so what we did was that we, first of all, if you have heard about the consolidated framework for implementation research, there is an adaptation by Asefa and McGovern, and that is basically for identifying facilitators and barriers to implementation and implementing an intervention. So we adapted this framework to suit our purpose, basically looking at 4 paradigms or 4 constructs. That is suitability of WHO frameworks for PHC, and then the PHC systems and stakeholders. So we will try to look at the whole of the PHC system and its stakeholders, what they think, the actors think this framework can do for them. Then we look at the PHC programming attributes and culture. We try to look at how their culture would also accept innovations like this. And then importantly, the PHC manages identification with the WHO framework. So what we tried to do was that we tried to find out, well, are they happy with it? They are not happy with it. And then we tease out the facilitators and barriers. So for each district, we sampled 6 people. We started by interviewing the district director and willingly asked her to recommend people that are very experienced. So most of these people had 10 years experience within the primary healthcare system. And then we kept on interviewing until we thought that we had gotten to saturation. So in total, we had 18 interviews. And then before interviews, because of the abstract nature of the concept, we had to do a PowerPoint presentation on the WHO framework to let them have an idea of this. and then we begin to proceed to ask questions on these constructs. That's the suitability, the systems, the programming and culture, and the manager's identification. Then now what we did was that interview responses were coded and classified into facilitators and barriers. So what happened is that where there was unanimous agreement or responses that a certain construct was a facilitator or was positive, we made it a facilitator. And where we thought that, well, everybody disagreed with something or thought that each thing was a problem, then we classify it as a barrier. So we'll move to the next slide. Yes, so after analysis, we began to see a number of things come up. I can't see part of my slide. I don't know why, but external policy and incentives became the #1 barrier. I cannot see that part clearly, but what it says is that before you can get PECs operate, you must be able to integrate this into their standard protocols and policies. That is because they operate based on these. So they are heavily regulated. And once we don't get mainstream into our agenda, it is just impossible to get them operate at full capacity for this. Now, the second one is cost. Obviously, we are in a third world country, and then the cost is always a problem. We can't even find most of our routine health services. So it is also identified as a very big barrier. So the argument is that PAC is resource stressed, and then you can find out, you'd see the quotes there, and I read it for you to get it. Direct healthcare facility financing is quite difficult. As I said earlier, most of our internal generated funds come from the National Health Insurance. And as I speak now, the NHIS owes us for about 10 months. Getting money to buy the essential supplies is difficult. So we have to fund such an activity. It is quite difficult. I think we need additional funding to make it successful. Another fellow says that in simple terms, I think those that do not involve money, we can. I think it is something we can do, but majority of the concept involves money. That aspect will be challenging to achieve now. So clearly they tell you that cost is a big barrier. There's competing things for resources. And again, they are not adequately funded. So the thing that to pick up additional issues on resilience would stretch them to the limit. Now there's something like peer pressure. You might think that, well, what is this? Now, like I told you, PAC facilities operate in a similar manner. They are standardized. They have similar reviews. They have similar structures. So for example, when there's a maternal death, it's a big issue. Every PAC is worried about maternal health because it casts across their policy standards and everything. They need to investigate that. So long as climate resilience and maybe mitigation, adaptation and mitigation, it's not on the agenda of PACs, then they will not do it. And once their colleagues who don't also do it, then they are not required to do it at all. So peer pressure is one of the things that comes up. So the idea is that in implementing this, we should be able to implement it in such a way that they have the motivation from their colleagues to do it. Then secondly, network, and thirdly, network and community and networks and connectivity, they do not have access to resources at all. When I say resources, not financial resources, material resources. So they don't even know the concept. When they want to learn about it, they don't know where to get it. And I think that is important for people like Chance, and then for community of practices that are coming up, so that these people are able to learn it and they can implement it and use it very well. Next slide. So I give you an example with this. We have the Ghana National Climate Change Master Plan for 2015 to 2020. You would see health is a priority sector. I read this document and then I saw almost everything that the WHO recommends in there. And I said, wow, what a beautiful document. They even went ahead to provide a mainstreaming framework to allow health systems to mainstream into their policies. This document ran between 2015 and 2020. So when I search health, I see exact matches of 447 words that talk about health. I see healthy, I see healthcare. Now I come to the National Health Policy that was also produced in 2020. That is the last year of this national policy document. I search climate, and then you find zero, no results found. So this highlight, first, it confirms what the people are saying about policies in PHCs to enhance mainstreaming. And then again, it also highlights the problem of coordination. Our health institutions or institutions in charge of climate change in the country are not effectively coordinating. So we are having a situation where we have disjointed policies. It is okay to build population resilience. That's very important by rendering routine health services. But again, like I told you earlier on, climate change has the potential to undermine our efforts to universal health coverage. So that is the irony of it. Once we have a beautiful national health policy that does not talk about climate change at all, but we have a beautiful national policy that talks about health systems, and lays down strategies as to how the health systems can mainstream climate change and policy. So policy, this confirms that policy is a big issue to deal with. And it's much more bigger at the PhD level where they deal with guidelines, protocols, and standards. Next slide. Yes. So what are some of the facilitators that you can see? Now, the first one is that most of the actors or PhD managers that we kind of spoke to, they love the framework. They think that it's very suitable for PhD operations. They actually think that, look, this is going to enhance everything that PhD stands for. And I read this quote. You can see framework contains everything to help the health system succeed. And climate change is affecting all these parameters. So if we can sustain all these parameters, it will improve the health systems. They basically agree that, look, this framework by the WHO is very suitable for primary healthcare. And when they use it, it's going to enhance the quality and access to healthcare facilities. So that is something that it is an extreme facilitator. They like it, it can work, very little adaptation to get it to work. Then again, for the managers that are supposed to implement this, they wholly agree with this because they think it aligns with what the mission and vision of the health systems, the PHC, and then it's something that they can work with. And somebody said, if implemented, it will help me do what I like to do. It will help me to deliver health services to the fullest of my capacity. Climate presents challenges to healthcare facility. If the infrastructure is destroyed, I won't be employed. So personally, I think it is good. So the managers generally think that, okay, this is they are willing to implement this, and it's a good one. Then there's the third one, tension for change. There was consensus that the current gaps in the delivery of health services at the PHC will galvanize total support for this framework of climate resilient and sustainable health systems. And then you can see somebody could, there are a lot of gaps in the health system, gaps in terms of hygiene, in terms of personnel, capacity, and the relationship between climate change and health, and then the various components. So they think that they all see the need, they see the effect of climate change, they have not really thought about it. And I think that this, for them, things that is going, if introduced, it will galvanize support for us at the PhD level. Next slide. So in summary, from what we see, mainstreaming climate action into PhD policies, protocols, and programs with inbuilt accountability mechanism, which we call take mainstream. So mainstreaming and financing as a prerequisite for action. These people are already financially stressed, but again, even if they have the finances and you don't mainstream, they are not obliged to do anything. So these are prerequisites. They are something that anybody that intends to do a kind of mainstreaming must work on. National policies must trickle down to subnational policies and health sector programs. And then I sum it up by this. A participant said, I do not know, but I think at this our level, the health system has a protocol. The best I can do is to adhere to the health system protocol with regards to service delivery and ensure that everything is in order. So that sums it up. Without protocols, without policies, without mainstreaming in these, you can't really move on. They can only help you test whatever you want to test, but it's never going to go on. Then again, like I already said, PhD managers deem WHO framework suitable for the context with very little adaptation. This is going to work, and that is a strength. Once they like it, I think that it's a strength for the framework. And then again, they also perceive that the framework is very, very effective. That is a WHO framework. So I think that on a whole, the PhD systems are really ready for this WHO framework. We just need to be sure that things are done in the right way so that we can move on. Next slide. Yes, so I'll end here. Any questions, go back. I'll end here and probably pick questions and comments from participants. This is the first part of the presentation. So after any questions or comments, then we can move to the next part. Maybe the questions are in the chat box. And then again, I think that if you raise your hands, then I think that it's possible for you to be unmuted, and then I can pick them up and then we move on. Yes. So I can see at the Q&A.
Yeah, so we have Rosel raised his hand and also someone else. So maybe if we can unmute Rosel to ask his question.
Thank you. Thank you very much. My name is Russell Rensburg. I work at the Rural Health Advocacy Project in South Africa. Obviously, climate is dominated obviously by two main responses. The one is mitigation, for future threats, and adaptation. The health sector generates probably a fair amount of emissions, right? And contributes to climate change. And in considering our responses going forward, I think I wouldn't say problematic. It's a bit of a challenge when we're not considering adaptation strongly, right? In South Africa, for instance, we have over 400 public hospitals. By the extent to which they are energy efficient, well located, like your Ghana example, as well as what kind of measures we can take with health system infrastructure to focus and take advantage and leverage climate financing for better mitigation, right? So that we are able to respond to the needs of communities as we move forward. The current framework, or in the presentation, I don't think we consider that enough, right? Much of our risks seems to sit outside of the focus that we're placing in the study, right? I think there are things that we can do in changing the package. There are things that we can do in reorganizing our health systems. There are things that we can do in addressing some of the infrastructure gaps. But to do so, I think we need a coherent strategy that focuses on all the different determinants and of climate impact. Thank you, and over.
Yeah, thank you very much for that observation. And I think that there are always trade-offs that we have to do. And if you ask me personally, in Africa, what we need to be doing obviously is adaptation first, because we are feeling the impacts for something we didn't contribute much to. So it's important to focus on adaptation. But how is this going to be done? Obviously, you can see it highlighted in the presentation that policy coordination is a big issue. And then again, we think our mitigation, of course. I strongly believe that you can do adaptation and mitigation slowly. You don't need the best technology in the world. For instance, I can give you an example. In Ghana, you go to the hospital, they are giving you a medication, and then they give you in a single disposable plastic bag. A decision to stop this it's already enhancing environmental sustainability or mitigation. How do we dispose our waste? There was a slide that didn't come up. It was about the way waste is disposed and the rest. So I agree with you perfectly, but again, it also highlights the need for collaborative work, stakeholder collaboration, especially at the sub-national level. Thank you. Can go to the next question.
So we have some already typed out, but I think we can take the person whose hand is still up.
Yeah.
That's Elliot for Indigenous.
Yes.
Founder and director. Sorry, Elliot, please go ahead.
Okay, thank you very much. Can you hear me?
Yes,
yes, we
loud
can.
and
Go
clear.
ahead.
Yeah. Thanks very much for the good presentation and the topic and the slides. We are really impressive. They're really impressive, and we appreciate. I just put some overview on the general concept of climate and health, specifically to indigenous communities that we are. I come from Tanzania, and I work with them. I work with indigenous community, specifically Maasai and hunter and gatherers, guards and here. My concern is, these communities, we have different knowledge and different perspective and different definition about health and well-being. And this is really a challenge that most of the research and most of the documentations have been only done on one side of conventional healthcare system, and leave behind a primary healthcare that has been supporting 1 million lives of people living away from access to healthcare systems that I can say conventional, due to the model of life that they've been gone through. Most of the indigenous community has been living in remote areas where they can't access any medication, conventional medication at all. And this is the life of this is because of due to their lifestyle. My concern with my ways is to network and to put together and how we can widen up and how can we document all this and publish and integrate our social and national policies so that we can they can be categorized also and identified, because health is not when you talk about health and indigenous community, you're not just talking something that is sacred. You talk about something that is healing. You talk about happiness. You talk about spiritual. They're not all about health as we know in conviction ways, that when you talk about health, you only talk about services, that's money, and you're been granting something so that it can be provided. You get service. So
hello. Sorry, Elliot, please can you quickly just wrap up? Drop your question so that or comment, because we are really running short of time. Thank you.
My question, I think so. My question is how can we now integrate this knowledge to our national policies so that we can base databases that can actually provide that can actually give the indigenous community the standing to be okay. This is this also is well known, and it also to be respected as the way it has been respected to other national or other healthcare systems. Thank you.
All right. Thank you. Okay, quickly, Rudolf, before.
Yeah, I think you are right. Indigenous people are the best people. They know already how to live with the environment. And I think that it is always proper to take their perspective. In the next section, we shall do a collaborative framework for implementing this, that we can take it into consideration. I think we are very right, and it's very important for PAC to reach out to them. Thank you.
All right. So, Rudolf, because of time, I think you can go to the second part quickly.
Yes, quickly, and then we can wrap up. Yeah.
for discussion, we can take some additional questions that are already typed. Please, participants, we are sorry, but you can still type your questions in the Q&A chat box so that we can respond to some of them and also during the discussion. Thank you. Over to you, Rudolf.
Yes, so back to the slides. Okay, so again, after diagnosing all the problems, how do we proceed? There's no point talking about all the problems, people like it and the rest. Now we will notice that financing and policy is a big issue. So till we get there, and since policy cycles are about 10 years nationally, how do we get there? So together we use design thinking methodology with about 65 healthcare facility managers and stakeholders to see how we can properly set in motion so that in future, we could also feed back to any policy development process. So with this methodology, first, what we do is that we obviously did an assessment of PHC facilities. Obviously, over 80% were not climate resilient. And then based on that, then we proposed low-cost interventions. And then we met in 5 working groups of storms, heat, floods, droughts, and wildfires. These are the ones that are predominantly available or that are predominant in the Upper East region of Ghana. But there are others. There are rising sea levels, there are cool waves, and I think that of late I'm seeing landslides and other things. But for us, this is what we focused on. So we review low-cost interventions, and then we co-created a collaborative framework that obviously takes advantage of what I call the windows of opportunity, so that we can build resilience and sustainability moving on. Let's move on. Next slide. Yes, I hope you can see this. To my left, you would notice that this is the organogram of the health systems. We have the Ministry of Health, obviously will do policy. It will come through the Ghana Health Service and regional, that is the national and regional, and they will not implement it in the PHC. The PHC is the district health system. It has district hospital, health centers, CHIPS zones. CHIPS are community-based clinics, and it has a network of outreaches, community structures, and everything. So we think that the PHC structure itself, it's an opportunity to leverage for now. And then how do we do this? First, we thought that, okay, all these low-cost interventions that we identify now, it is better to leverage on legally mandated structures. And first, we find a district health committee that is a multi-sectoral committee of all key stakeholders in the health sector mandated by law. So we think that, okay, can we begin to push this agenda by orientating these people to get the concept of climate change and health systems, climate resilience, and the rest? And then again, once we orientate them, can we begin to look at climate considerations? And how do we do this? Obviously, we can't go to the national level to do this. So we noticed that there's a district health sector medium-term development plans that these people work with, which is in their control, which they can put it in, and then every financing that comes from the local government will take into consideration this. So if we mainstream climate change and health systems, adaptation and mitigation into this district health sector medium-term development plan, it already set the foot for implementation. Then obviously we thought, okay, you oriented the healthcare facility managers, and then we think that they should apply the WHO framework. WHO has a checklist for assessing the climate resilience and the environmental sustainability of health facilities. You apply the checklist. The WHO emphasis on adaptation. So again, it's a whole process. You first need to identify what you are exposed to, the climate hazard you're exposed to. And based on that, you apply a specific checklist. And then based on these checklists, we recommend that, okay, these people can put in place a climate resilient improvement plan in their respective health facility annual plans, district annual plans, and everything. And then once they put it in their work plans and they implement it, they also integrate it into performance reviews of the district. So the district have quarterly, half yearly, whatever, meetings, everything, they will integrate this. And then again, it's cyclical. It keeps on going on. So once they do it and they review it. So that is the proposed collaborative mainstreaming framework that we proposed. Again, so this is supposed to already start the bottom-up approaches. And then whilst we learn, we advocate until we are able to get such a time that the national level policies are able to trickle through. Next slide. Yes, so in conclusion, we think that the TIC mainstream framework enhances the usability of the WTO framework because already it brings people, and then it will find a way of integrating into a very formal document at the subnational level or PAC level. And then again, it also gives a systematic application of the WTO framework at the subnational level. And then it has the potential to enhance effective collaboration and buy-in into climate action within PAC and even within other sectors. And then again, once we have this in our district plans, district health sector medium-term development plans, it will stimulate autonomous adaptation. People will begin to work, and then they can try things because it's in their plans. And then again, it is worth noting that over 50% of financing of PAC programs come from development partners. And then, like I said, if climate resilience and environmental sustainability is part of the district health sector medium development plans, it means that we can really use this to leverage resources. So every partner that comes in with resources, okay, we need to see how you can build resilience, climate resilience, environmental sustainability, or what are your climate dimensions of this? And then again, the health sector is very, very PAC, it's very, very respected. We believe that this can let the health sector influence other health determinant sectors around the PAC. And finally, it will strengthen bottom-up approaches for sustainable action. So I think that in summary, this is what we have. We'll move to the next slide. We are running against time, where we try to do a few discussions. But again, we are guided by these questions. And then what are some of the context-specific barriers to mainstream climate change in your locality or whatever? And what are some of the entry points? So I think that we can go back to the discussion points. And then if there are also other questions, we will reserve them for the last. I would like to hear from participants first, and then we can proceed with the rest of the questions that we couldn't answer.
So we'll quickly do a quick Menti.com feedback section using those questions that Rudolf has just brought up. So the link, let me know if the link, okay, the same link we had before, I suppose. So check the chat box of this webinar. You will see the Mentimeter code is Menti.com. That's www.menti.com. You can either use your phone or your laptop and then type Menti.com. And then the code you will put in is 491-38452. I repeat, Menti.com. The code is 491-38452. We'll just quickly use that to get some of your perspectives that will also inform the discussion. So the first question should be up there now, and it says, what are some context-specific barriers to mainstreaming climate change adaptation and mitigation into health systems operations in your locality? Possibly you can look at primary health care. I know when we say health system, so our focus today is pretty much around primary health care.
Primary health care, yeah.
Yes, that will help. Okay, we've started getting some answers. So Menti.com, code 491-38452. Then after this, we'll take we have some questions already in the chat box. So Rudolf, while this is happening, you can also check the questions. Gloria, colleagues from the Chance Network, you can also chip in. For instance, someone was asking about something on digital health initiatives. And also, if you have any response, great. So we can see some of the context-specific barriers. Climate finance needed, very well. Lack of policy drivers, inadequate infrastructure, upstream supply chain, issues of cost, inertia, political will and inertia, or even political inaction, policy inaction.
Yes.
Yeah, so politics is really showing political barrier, political will, absolutely. The built environment.
Yes.
Competing priorities, excellent, makes a lot of sense.
Yeah.
Expertise in even understanding what is climate change, how to do the adaptation and all of that is also important. The organizational structure, issues of resources, expertise. Yeah, I think these are really, really, really great. So maybe possibly we can go to the next question.
The next question, yeah. Next question. Can we have the next question? Hello.
While we are waiting
for the next question. Yes. So I want to touch on technology. It's very important. I think that it's important in today's primary healthcare system, and then technology has the potential to improve UHC, universal health coverage, and also build climate resilience. For instance, we have telemedicine, we have mHealth applications. We are beginning to have very sophisticated non-invasive tests. I know of something that we did some years ago. It's called Check Together. It's like a laptop bag. It can do all the tests for ANC clients recommended by the WHO just by putting a laptop bag. That builds UHC, that builds resilience. So when there's a climate hazard, like I told you, okay, I was coming back from the field and I got trapped. The woman doesn't need to go to the travel to the health facility to test. Or when there's a big hazard, that is just a bag. It's supposed to use to render services. So technology is very important for this. And then again, I also want to, there are issues of political commitments that had come on, which I want to discuss. One of the main, yes, go on.
So we have the next question. We can, the second question is up now. What are some PAC/health system entry points in your country for mainstreaming climate change adaptation? Very, very important. What are some PAC or health system entry points for mainstreaming climate change adaptation in your own context, in your own country or community? Please go ahead and share your answers or your responses. Still on the Mentimeter, the code is still 491-38452.
Yeah, so once there's a hand up,
okay, we are still waiting for the responses.
Yes.
For this second question. While then, Rudolf, you can quickly, someone has asked about policy changes required for climate resilient PACs. I think the framework you shared from Ghana experience can speak to that.
Yes, and again, beyond policy, it's about politics. We talked about politics. It's about values and belief systems. So for instance, what are the trade-offs? The people want a clinic. What does the politician do? He gives you a clinic. That's all. Is that okay? So I think that it is important to also make a very convincing argument, which so far I have not seen it explicit somewhere. Moving forward, we also, as health system practitioners, need to begin to look at things about the return on investments to be able to be sure that we are able to demonstrate value for money for building climate resilient health systems amongst health system policymakers. Then again, I think that you see, we can't wait to get there. It's affecting us every day. And then what we do is that we can begin to look at these dimensions. Like I give you an example. Sometimes bottom-up approaches are the best. So we look at these examples like I spoke about single-use disposable polythene bags. I believe it's across Africa. You go to the health facility, they just give it to you. That is affecting the climate. That's a mitigation issue that can be dealt with. So again, importantly, I'm coming to believe that the more we also dialogue with other sectors, multi-sectoral collaboration is very important, even at the subnational level. I believe in other countries, they might call it county or they might call it a state or something. In Ghana, we call it district. There are resources there, which are called windows of opportunity. Partners come there. So it's better to start dealing with people from all other sectors so that collectively we can already grab the resources there to test what we do. And for people who have the money to give to other people, when giving them the money, can you look at dimensions? Just don't come give them money to implement or test whatever they're doing. Begin to implement built-in resilience actions for the health system. So little by little, we get there.
Okay, thanks. We are getting some responses now.
Yes.
To this question around entry points. So funding opportunities, building standards, I guess in terms of infrastructure, making sure that we have PACs, that in constructing them, that they are climate resilient and of course adaptable to the climate. So great, climate resilient infrastructural upgrades, technical guidance for managing heat risk. Yeah, especially with global warming, and we have a lot of heat waves now happening. Climate risk insurance, that's another interesting issue with respect to financing, climate financing. Non-health private sector collaboration, which Rudolf had already mentioned about intersectoral collaboration, because in some countries you have the Ministry of Environment who's may have a major role in issues around climate change. You have the Ministry of Finance that is responsible for financing and all. So yeah, I think these are really interesting insights, health systems research and health information, community engagement, multi-sectoral collaboration. And in South Africa, district clinical specialist teams are involved in PAC re-engineering and will be good to get on board. Oh, great. These are really, really, really good responses and all. So maybe I think we have one more question. Yeah, so that once we do that, then we can wrap up and respond to some of the other questions. So this question is like, do you think the proposed collaborative framework can be adapted for use in your country? So you can either disagree, agree, strongly agree. So the responses are, the different options are there, 5 options. First is strongly agree. Do you disagree? Or, yeah, so we have more people, some are neutral, but we'll just leave a few more minutes for this while we are filling this. So, Rudolf, there are some questions I wanted to just bring to your notice. Yeah. So, someone, Bahata, I'm sorry if I pronounce it wrong. She asks, have you assessed if health facilities are climate resilient? If so, which tool did you use? Was the WHO 2020 document, I mean, the framework on climate resilient and sustainable health facilities, easy to adapt for assessment? So maybe you can share what the...
Yes. I assessed them. I assessed 65 health facilities, primary healthcare facilities. I used the WHO checklist. The WHO has a checklist for assessing climate resilience and environmental sustainability of healthcare facilities. It's difficult to adapt. You need a lot of time to do that. But I think that on the whole, it's still relevant for health facilities. And then what we did was that it's a process. First, you need to identify exposures to climate hazards. And then based on that, for example, if a health facility says, okay, storm, we observe storm, and then it's impacted on the components, then you go ahead to use the tool. Now, the tool looks at international standards, everything. So probably it is much more better to adapt, but it's difficult to adapt. But I think they are still relevant. So once you use them, the WHO also goes ahead to give you a template for planning. So basically, all this work is a result of using that tool. I agree that it's difficult to adapt, but even if implemented, I just recommend that please implement it. Some questions might be off board, but you begin to learn whilst you are doing it and you adapt what's going on. Otherwise, you just sit down in the room and adapt for people and think that that is it.
All right, thanks a lot. Another question from Emmanuel. He was asking if there are monitoring mechanisms to account for PAC's direct and indirect dependency and impact on nature. I mean, so possibly are there frameworks or mechanisms for accounting or monitoring how PACs possibly impact on the environment?
Yes, I think I've seen a number of frameworks. I think Aga Khan has one. And then I've seen from another one from 60 decibels or so. They are there, but they are complex to use. And then again, I advise that depending on your capacity, you could begin to use those things. But again, we need to find out, do we start adapting whilst we also check mitigation and work towards it and the rest. So there are tools, but the key word is adaptation that you need to use.
Yeah, thanks a lot. And so David Ziveri, thanks for your comment. So he was asking about that he says he believes that converging policies and integrating programs is crucial when there are opportunities for adaptation. But one specific, which was important, is about disability inclusion as we work towards adaptations and all. So I think that's really important because even for the broader health system, disability inclusion, it was just last year that WHO World Health Assembly passed the first resolution on rehabilitation and disability with respect to ensuring that rehabilitation is incorporated fully into countries' UAC program. Thank you. And okay, the policy processes, we've already discussed that. Chris Gordon, your question about how do we define indigenous people, I think it's not something we can discuss now, but so in Nigeria, for instance, I'm from Nigeria, so we discuss about people who are indigenous to an area and then those who are visitors. So you have, because we have different tribes, different indigenous people. So yes, we do have indigenous people in Africa. So in a city, you may have the aborigines, the original owners of that land. Then you have, but I think it's something we can discuss later.
Yeah, and then to add to that, the PAC structure, because of indigenous people, sorry to interrupt, the PAC has a network of structures that are supposed to reach every last mile. This includes indigenous people, people living in very remote areas, people that are living with nature. And then I think that is the reason why PAC plays the role here. PAC can bring on board the thoughts of these people so that we learn and integrate it. But I think we need to look at all that in totality.
All right. Thank you. Thank you. I don't know if we have any more questions.
There's a hand up, Jack.
Oh, great.
Jack Key. But we are running past our proposed time.
Maybe just 4 more minutes. 4 more minutes, we can just wrap up. Yeah. Okay, please, can we unmute the person so that he or she can speak? That's Jackie Dube. Just once, a few seconds, just ask your question once you're muted. Jackie Dube. Okay, while we are doing that, there was another important comment by Russell about making sure that our core as health systems actors is to make sure that we deliver the essential services. RMACH, infectious disease, non-communicable diseases and all, but we should also interrogate our processes and protocols in how best we can optimize health system response to risks of climate change. Thank you for that. I completely agree with you. Okay, so Bharat, I think maybe you can drop your email and then so that Rudolf can connect with you later. So Rudolf is asking if you can share the climate resilient assessment tool with her or with him or her.
Yeah, that's okay, but it can be found on the WHO site, www.who.int. It is really available. Just Google it. It's fine. You'll find it live there. It's easy to find on the internet, but I can share with you as well.
Okay, Jeff, since we're having a challenge on muting you, can you quickly type your question in the Q&A chat box? Otherwise, because we are really out of time, we are supposed to finish 3 minutes ago, but we can maybe stretch it just for a few more minutes while we wait for that question. Or you can type it if possible so that Rudolf can respond. But Rudolf, are there other questions that we've not responded to?
Yeah, I've not looked at the chat box because I was busy, but I think that
okay, sorry guys, one from Toby, he's interested in the policy process, but one interesting one is, like he said, are there good examples of a climate resilient PAC in Ghana, and how was that feat achieved? So maybe during the course of your research, did you find any PAC that you could say that maybe either progressing towards being climate resilient?
Yeah, there were a number of them. I think close to 13% of them were progressive. But again, I would like to let you know that the progressiveness was coming from the bigger health facilities, say the hospitals. They had the ability to finance their need. So they preempted, they financed it, and then they were building resilience. And then again, a lot of NGOs, especially in the water and sanitation sector, healthcare waste, were coming in to partner with PACs to do these things. So we don't have a complete resilient facility. In my opinion, it's difficult to even measure what complete resilience is, because this changes over time. So there is progress, but again, like I said, there are policy hedges, there are financial hedges, but this is attainable, and we can build a whole lot of momentum around it.
All right, thank you so much. And apologies to those whom we couldn't take your question, but all the questions here, I think the organizers will curate them and possibly provide some responses. And then I know people have asked about the slide deck. So this webinar is recorded. So, and I think it will be shared to participants. Rudolf, if I'm not mistaken.
Yeah, I think it will be shared. It will be found on the Chance website. And then again, I think that it's also, I recommend that they put the slide deck too, because in the process of presenting, I noticed that some of the parts of the slides were missing, probably because of differences in word apps, the year and the rest. So I think they can get it from the Chance. So remember to register with Chance. It's easy to do it, and there are a lot of resources there. Our SSG technical working group too, there are a lot of resources there that you can help. And then we have a Google groups that we will share all these. So just hook to them, SSG, our technical working group, and then the Chance network, and then there'll be a lot more. And you can reach any of us at any time. Yeah.
All right. Yeah, so I think it's important we just, in wrapping up, I really want to thank everyone who made out time to join us today. I know we could discuss and continue our conversation offline or online on the platforms that have been shared, but it's really great that we are discussing health, the implications of climate change on health systems, and how we as a continent can start making sure that our PAC systems are resilient to climate change. And it's really great. And climate change has become an important conversation. If you notice that just, I think a day or 2 days ago, Donald Trump and Elon Musk had a conversation on X, that's initially called Twitter, and the conversation was around climate change. So it's really great that we are having these conversations. And just before we wrap up, please be sure to join the Chance Network. Also, there are a lot of resources. Some people there is some training courses on climate change. The link was shared in the chat box that Columbia runs, which is great. And also you can join the TWG, the Health Systems Global TWG on climate change and resilience, sustainable and resilient health systems, which is free for you to join the TWGs. And there are a lot of resources you can interact. Like Rudolf is the vice chair who coordinates the TWG on behalf of Health Systems Global for Africa Network. So we really want to thank you. And I also want to remind you about the conference in October. If I'm not mistaken, the links are also there. And we have a global symposium on health systems, global health systems research in Nagasaki later in November, the second part of November. And the main theme is even around climate change, resilience, and also it will be great. You can go to Health Systems Global website to get more details. But overall, we really want to thank everyone for making our time to join us. I also want to thank the organizers who supported us, Celeste, Gloria, and more importantly, Sari, who made sure that all of us were able to connect today. Thank you so much and have a wonderful day. And we'll see you again very soon. Bye.